Good afternoon, all. Am I audible? Is my screen visible? Please mention in the chat box. So in today's session, we'll be discussing on the chapter of diet in gastrointestinal diseases. It's chapter 17, page number 361. Those who have the textbook, page number 361. If anyone is joining late, please help them out with the page number, chapter name. So we'll start with the session, diet in gastrointestinal diseases. So first is in basics of gastrointestinal diseases and some other disease conditions as well, which may not be covered in this particular session. We have covered that in the previous week's Wednesday class. Okay, so you can check the playlist, disease conditions playlist. In that we have uploaded the video, what we have discussed on last Wednesday. So some other disease conditions also have been added in that session. You can check that as well for your knowledge. Okay. So GERD, it stands for gastroesophageal reflux disease. Okay. So usually what happens is that if you look at the esophagus, this is the esophagus through food pipe. Okay, through which the food enters and it goes into the stomach. You can see here the sphincters. Okay, there are two sphincters on either sides of the esophagus. Muscles, okay, these are muscles. They open and close. They contract and relax. Okay, they open and close. As soon as the food comes here, the nerve reflexes will make this sphincter to open so that the food can come in. And as soon as the food is reached the stomach, the sphincter will close. Okay, so why it closes? So that the food, while when the stomach is in contraction, stomach will contract and relax. Okay, that's the process in which the stomach has to churn your food. Okay, so when the stomach is contracting and relaxing in order to mix the food that you have just now provided, to mix it with the gastric juices, hydrochloric acid, okay, at that particular point, this sphincter has to be closed. Okay, otherwise the contents may slip out back into the esophagus. So this is what happens in a normal stomach. What happens in a GERD reflux syndrome is that the sphincter remains slightly open. It does not closes properly. Okay. And whenever the stomach is in the churning mode, or even if it is not in this churning mode, the food along with the gastric juices and hydrochloric acid will go back into the esophagus. Okay. Not necessary the person may vomit, but it will go back and this will cause heartburn. Okay. Burns here. That is what you say, that acidity. Okay. The reason being only parietal cells in the stomach has the ability to have the to take in the impact of hydrochloric acid. The same cells are not found in the esophagus. So definitely it will feel the inflammation, irritation, and burning sensation that hydrochloric acid will lead to. Okay, so this is GERD, gastroesophageal reflux syndrome. The food is getting refluxed back into the esophagus. Okay, so causes. Sometimes we also say that you should chew your food properly, eat slowly, don't eat in a hurry. Okay, this is one of the reason why. Because when you're eating when you are eating food in a hurry, as soon as the esophagus is not even closed properly, or it is not ready to accept the food properly, then another bolus of food is entering. Okay, and at the same time, when the stomach is in the churning mode, the esophagus will open, the sphincter will open, and it can lead to reflux. So that is the reason why people say that you should eat slowly. Okay, so poor diet, with its huge increased consumption in sugar, fat, having a lot of soft drinks, cold drinks, processed food, that could also lead to GERD. Eating late, and that too indulging in meal. For example, if you're doing intermittent fasting and all, when you eat a lot of food in one go. Okay, that could lead to acid reflux. Not eating properly in a schedule. Okay, chaotic eating means not having a proper eating schedule, not following a timetable of eating. Stress, long hours of starvation. Okay, and along with that, when you eat food, you eat oily food, consume oily food. Smoking, alcoholism. Okay, these all can exaggerate the GERD reflex syndrome. And what happens is that, like, certain lifestyle changes which you can do to treat GERD or to reduce the impact of GERD. If you are a smoker, try to quit smoking, exercise regularly, sit up and like straight, like don't slouch over. Okay, sit straight while eating. Eat small meals throughout the day. Chew the food slowly. Avoid heartburn triggers, for example, spicy food, too much of sugary food. Wear loose and comfortable clothing, because when you are having a lot of wearing a lot of tight clothing, tight fitting clothing, that could also lead to reflux of food back into the esophagus. Specifically, on tight clothings, if you are having a stomach full of food, that could also lead to reflux back into the esophagus. Sleep with your head slightly popped up. Okay, those who have acidity issues specifically. Minimize your caffeine and alcohol consumption. Not Do not have too much of coffee. 2 cups per day is completely fine. Avoid lying down for at least 3 hours after meal. Okay, as soon as you have had food for 3 hours, sit straight, stand, do some things, but don't lie down. Okay, that could also lead to reflux of food back into the esophagus. So next topic is indigestion. Indigestion in simple terms could be defined as difficulty in digesting food, which in turn might cause some kind of uneasy sensation, some stomach ache. Okay, it is also called dyspepsia. Okay, so not able to digest properly, indigestion. Okay, dyspepsia is the medical terminology for that. There are various causes of indigestion. It depends from subjective causes. Certain people may lack certain enzymes that help in digesting the food. For example, lactose intolerant people, if they are having indigestion, it's because the lack of lactase enzyme. Okay, and you consume some dairy product, milk based product, lactose based product, that could lead to indigestion. And usually indigestion is not a disease condition. As it is, indigestion usually tends to be the symptom of some other disease conditions. Okay, so it's a whenever you have any gastrointestinal diseases, usually whenever you have gastrointestinal diseases, usually you will have indigestion as a symptom. Okay, that accompanies most of the GI disorders. Coming to the management part of indigestion, like if you have too much of food in one go, and in that too, that particular food is a junk food, high in fat, sugar, caffeine, spices, alcohol. These are usually associated with indigestion, dyspepsia. So if you restrict this food, you can have a healthy stomach, an indigestion free day. Eat slowly, chew thoroughly before swallowing, eating at regular times, okay, and in a relaxed atmosphere. While you're eating, try to be stress free, relax yourself. Eat small and frequent meals throughout the day, and try to avoid gas forming food, which may be subjective. Again, gas forming foods are also subjective. Like few people tend to have like majority will have gastric issues with rajma or chole. Okay, or some other kind of pulses or legumes which are known to cause gastroenteritis. Okay, try to avoid or restrict those food. Next is peptic ulcer. So what is an ulcer? Ulcer is a wound. Okay, ulcer is a wound that happens in your mucosal membrane. We call it as an ulcer. Okay, mucosal membrane has a wound. We call it as an ulcer. Okay, so what is it? What happens in an ulcer? The mucosal lining undergoes erosion. Okay, it undergoes erosion. A hole is getting formed in the mucosal lining. Okay, in the stomach or any part of your alimentary canal. That alimentary canal means your gastrointestinal tract. Okay, from your mouth till your anus, it is an alimentary canal. Okay, all this part has a mucosal lining. The entire alimentary canal, the entire gastric tract has a mucosal lining. Okay, so wherever in the mucosal lining an erosion is taking place, okay, a hole is forming, a wound based hole is forming, that's a ulcer. Okay, peptic ulcer is the one that happens in your stomach or in your duodenum. Okay, so what happens specifically in this peptic ulcer? Along with this wound formation, when when the stomach has enough amount of hydrochloric acid as well that is secreted, it will cause more trigger. Peptic ulcer will be triggered more. It could lead to more inflammation, further erosion. Okay, and when the peptic ulcer is healing, once it heals, a scar formation is formed. Okay, means the parietal cells which we had here wherever the peptic ulcer was will be destroyed. It will when a scar formation, a scar tissue is formed, whatever was the function of that particular area cannot be repeated again. Scar tissue cannot do the function of the tissue it has replaced. Okay, so peptic ulcer can heal with medication, with dietary changes, with lifestyle changes. You can heal peptic ulcers. Okay, but once the scar tissue has formed, it will lose that particular area wherever was whichever was affected by the peptic ulcer will lose its function. Okay, so causes. The main cause of peptic ulcer is either you have a Helicobacter pylori infection. Okay, H. pylori is we call it in short. Okay, H. pylori or Helicobacter pylori. That is the main. That is one of the main causative agent. And second situation is having a lot of non-steroidal anti-inflammatory drugs. NSAIDs stands for non-steroid anti-inflammatory drugs. Okay, so these are drugs taken by, like, for example, aspirin. Long-term consumption of aspirin could also lead to peptic ulcer. There are other anti-inflammatory drugs as well. So long-term consumption of those drugs could lead to peptic ulcer. So there are two types of peptic ulcer. One is gastric ulcer and one is duodenal ulcer. Okay. So in gastric ulcer, when the ulcer has taken place within your stomach, any part inside the stomach, that is gastric ulcer. Any part in your duodenum, it becomes a duodenal ulcer. Okay. Sometimes too much of secretion of hydrochloric acid could also lead to ulcer. So in that case, you may have to you may have to use H2 receptor antagonist or any antacids. Okay, has to be used, which reduces the acid secretion in your stomach, so you can get some amount of relief. So what are the symptoms of peptic ulcer? Reason for when you are having a lot of junk food, like for example, lot of fatty food to uh, to cause the assimilation of that fat, more hydrochloric acid is required. When you have more a lot of sugary food, that could also require a lot of hydrochloric acid secretion. Sometimes it is inborn. Some people are born with higher secretion levels of hydrochloric acid. Some lifestyle, like having too much of stress, okay, having too much of stress, anxiety issues could also lead to hypersecretion of hydrochloric acid. Okay. Usually it is your lifestyle, lack of exercise, and having a lot of junk food. Okay. Regularly having junk food on a daily basis and all that could increase your hydrochloric acid secretion. Okay. So you will have a burning sensation in the upper abdomen. Those who have peptic ulcers, they will always constantly feel bloated. The stomach will be distended, heartburn, because whenever they eat something, hydrochloric acid is secreted, and that hydrochloric acid is also in triggering the ulcer area. Nausea, vomiting. Okay, dark stool. Because why dark stool? Peptic ulcers will also bleed. Okay, peptic ulcers will bleed, and this blood mixed with food, blood will get clotted. It will undergo coagulation. Okay, so that's the reason why the stools are dark in color. Okay, that's only in severe cases of peptic ulcer, when the uh, when there is a lot of internal bleeding out of the ulcer, lot of internal bleeding, and that's why you get dark stool, because it's a clotted blood is found in these stools, defecated feces. Okay, unexplained weight loss, that is also another cause of peptic ulcer. Anemia also. Okay, because a person may be in severe cases. Okay, in severe cases, person will lose a lot of weight. First of all, they will not feel like eating anything. Their appetite will become drastically low. Absorption rate from the intestine will be also low, because there will be a lot of internal bleeding. Okay, so these causes will lead to severe weight loss. So in severe cases of peptic ulcer, dark stool and unexplained weight loss is seen. Other symptoms are burning sensation in the upper abdomen, bloating, heartburn, nausea, and vomiting. Now, the diagnosis of peptic ulcer or duodenal ulcer. Endoscopy can be done. Biopsy can also be done. Endoscopy means you insert a fiber optic device inside through the mouth. It will go inside through the esophagus. It will reach the stomach. Okay, through this fiber optic device, you will be able to visualize the insides of the GI tract. Okay, then biopsy, a part of your tissue can be removed and noticed under microscope. Presence of helicobacter. Okay, presence of ulceration in the mucosal lining. Okay, that could diagnose the situation. Stool examination for dark tarry stool. Blood examination, urea breath test. In urea breath test, the patient will be given small amount of an isotope of carbon. Okay, isotope of carbon is given to the patient. The patient will eat it, and after some time, the patient's breath will be collected. Okay, and the presence of carbon dioxide is seen, like specific gas that has to be secreted by the bacteria. These bacteria are able to take in the carbon isotope that you have given. They consume it and they give it back into the breath. Okay, so that is a urea breath test. Then we do the upper GI. The upper GI barium study is done, in which barium swallow is done. Okay, and a barium based small flavored, so orange flavored, lime flavored barium. Barium is allowed to like the patient is given this barium. Barium is it is radio opaque. It will not allow the x-ray to pass through it. So the barium will go and attach itself to wherever the ulcers are formed, because ulcers are like erosion. Okay, it will go and attach itself to the eroded parts, and when you see the x-ray of the person, you will see exactly where and all the barium has get stuck. Okay, barium is stuck in the GI tract. So that is the barium study. CTs can also be done. There are two types of ulcer. duodenal ulcer and gastric ulcer. Peptic ulcer is divided into two parts, duodenal ulcer and gastric ulcer. That's based on where it is situated. Okay. When we say duodenal ulcer, it is understood it's in the duodenum. Gastric ulcer, we know that it's in the stomach. Okay. So treatment of peptic ulcer, this is the medical treatment. It's given, it is prescribed by the doctors to reduce the secretion of acid, H2 receptors, H2 hydrochloric acid blocking agents, antihistamines can also be given. PPIs can also be given that will it can prevent nausea and vomiting. Okay. Anticholinergic drugs, PG analog drugs, antacids which are systemic, non-systemic. Okay. Ulcer protectives like sucralfate, colloidal bismuth citrate. These are given as a swallow. Ulcer healing drugs are given. Anti-H. pylori drug. It is antibiotic. Okay, it is going to kill the, if it is the causative agent is Helicobacter pylori bacteria. In that case, antibiotic is also prescribed. Okay. So these are the treatment. This you do not have to study. This is just for your knowledge. Okay. What dosage, what frequency and all that is decided by the doctors. Dietary management. Sound total nutrition. Make sure that the patient has optimum intake of all the vitamins and minerals. A balanced diet is given to the patient to support the recovery. Specifically, vitamin C intake should be increased to support the healing, wound healing. Protein-rich food has to be given. So milk has to be included because it has a source of nutrient factors that can support healing. Protein will also have necessary amino acids that can lead to the healing of ulcer. Fat should be in moderation. Moderate amount of fat can help suppress the gastric secretion. Too much of fat can increase the gastric secretion. So fat should be in moderation. Fried food should be avoided. Fats like cream, butter, olive oil. Okay, you can add that in the diet. Carotenoids. Carotenoids have antioxidant effect as well. Okay, it has been seen as the carotenoids is potentially toxic to Helicobacter pylori. Okay, so the presence of carotenoids can reduce the spread of Helicobacter pylori if the causative agent is Helicobacter pylori. Ascorbic acid, that is vitamin C. It helps in healing. Okay, it's known that vitamin C helps in wound healing. So citrus fruits, tomato juice, this can be given. You do not have to worry about the acidity of the food. It's not that the patient is suffering from peptic ulcer, so we cannot give them acidic food. The acidity of the food or the pH of the food before you have ingested or before eating has no significance. Okay. Correct B12 B12 deficiencies, specifically if they're vegan or vegetarian, through supplementation. Gas forming food has to be completely avoided. Certain vegetables which are strongly flavored or sulfur, the vegetables which have sulfur, okay, like cabbage, cauliflower, onions, okay, turnips, fried fruit, strongly flavored food are you tend to be gas formers. To avoid that. Large meals has to be avoided. Okay. Fiber should be included in the diet. It is proven to be beneficial. Avoid irritants like pickles, spices, alcohol and smoking. Reduce your caffeine intake. Okay, if you are on NSAIDs like aspirin, nicotine, okay, these can delay the healing. So you have to check with your cardiologist on what can be done in this situation. If the patient is suffering from peptic ulcer and the patient has an aspirin situation ongoing, so make sure that both the specialists have a talk with each other, the gastroenterologist and the cardiologist, and they will choose a better a treatment option for the patient. So about peptic ulcer, is it clear? The dietary management part is what is important for you. Strongly flavored vegetables are also considered as gas formers. And it is very subjective as well. Generally, strongly flavored vegetables, sulfur containing vegetables are gas forming. But otherwise, what is a gas forming food is very subjective. Some people can be suffering from food sensitivity to specific kind of food, and that could lead to gas formation. Then we have gastric surgeries. In gastric surgery, uh, any form of gastric surgery, if it is done in the jaw or in the esophagus, etc., where swallowing difficulty is noticed, in that case, the patient may be put under NG tube feeding. Okay, so tube feeding comes in various form: NG tube feeding, gastrostomy tube feeding, jejunostomy tube feeding. Okay, these are different types of tube feeding, and the kind of nutrition that you can give through all these tube feeding is also slightly different. Okay, NG tube feeding, regular diet like regular juices, clear fruit juices. Okay, these can be given. Gastric tube feeding as well, slightly hydrolyzed version of foods can be given. Jejunostomy tube feeding, you cannot give them regular diet. You have to give them hydrolyzed formulas. Okay, which a hydrolyzed formula means partially digested food has to be given through jejunostomy tube. Okay, because that food has happened undergone the digestion, the partial hydrolyzation in the stomach. So hydrolyzed food has to be given to jejunostomy tube. So fluid in the fluid by the mouth is usually allowed, like water, and sometimes ice can also be given. Ice can be melted in water, and frequent sips of water can be given if the patient is feeling thirsty. Even if the patient is on NG tube feeding, their tongue may feel dry. Okay, they may feel they want to sip a little bit of water. Okay, they may feel thirsty. So in that case, slight small amount of water through mouth can be allowed. Okay, you can place ice also. Ice will slowly melt. Small pieces, small chips of ice, not large ices. Small chips of ice can be placed in the patient's stomach, mouth. Okay. Next is dumping syndrome. Now we are going to the intestinal diseases. Okay. Till now we have discussed few diseases that are under the upper GI tract, esophagus, and the stomach. Now we go to the intestinal diseases. So dumping syndrome usually happens when instead of digesting the food properly in the stomach will directly put everything into the duodenum. Okay, without digesting it or without churning it properly, the stomach will directly dump everything into the duodenum. Okay, so uh, It can usually happen in people who have undergone some gastric bypass surgery, dumping syndrome. They are more prone to dumping syndrome. So when what happens is that some days when you have too much of food, larger than normal amounts of food or liquid, okay, you have the gastric emptying means food in the stomach. When it leaves the stomach, we call it gastric emptying. That's a there is a regulated way in which the food will go out from the stomach into the duodenum is the part of your small intestine. Okay, so it is in a regulated mode. Bit by bit, small bolus of food will enter the duodenum. Okay, that's the normal way. But in dumping syndrome, it does not happen like this. Within a small amount of time, okay, hardly 15 to within half an hour or within 13 minutes, okay, a large quantity of food will directly be dumped into the duodenum from the stomach. Okay, so this because the frequency in which the stomach is opening and dumping all the food into the duodenum is too high. That's why the name has come, dumping syndrome. Okay, so dumping of food and beverages directly into the small intestine without proper gastric emptying, without proper hydrolyzation in the stomach. Okay, so in this situation, patient will, as soon as the dumping happens, the patient will undergo certain symptoms, will witness certain symptoms like weakness, dizziness, vertigo. The patient will feel like they will fall. Okay, they can't sleep, they can't sit. When they have too much of food, you feel that agitation. Okay, tachycardia, your heart rate increases, stomach cramping will happen, you're not able to eat anything more. Okay, epigastric fullness, that is the upper stomach fullness will be seen. Okay, so these are the symptoms that happens. Usually the patient will also feel nausea and vomiting kind of situation. That's the body's response of trying to take dump everything outside the body to reduce the stress on the GI system. So there are certain situations in which dumping syndrome is very common. Usually when as I mentioned, you have certain sphincters, okay, esophageal sphincters you have at the end of the esophagus, which opens into the stomach. In the same way, you also have sphincters below the stomach, okay, gastric sphincter, which open up and they open into the duodenum. When there is something wrong with the opening and contraction and relaxation of the lower sphincters in the gastric area, that could also lead to dumping syndrome. Okay, so it could be anatomical, it could be biological. Okay, it could be after any surgery. Usually gastric bypass surgery patients are at higher risk of dumping syndrome. Okay, so certain management which you can do while if you want to prevent dumping syndrome is that do not take too much of water or any fluid along with the meal. Okay, try to reduce high carb meal, go for low carb or moderate carb, high protein meals. Like, do not have too much of carbohydrates in one go. So if these kind of dietary modifications can be done and some lifestyle can be adjusted, like if you're putting yourself in starvation for a long time and when you eat, you immediately eat large quantities of food and water. Okay, so that could lead to dumping syndrome. So try to avoid that kind of situation. So small, high fiber, high protein meals should be eaten by the patient. Dietary supplements can be given to the patient to correct any micronutrient deficiency. So pharmacological interventions, acarbose, it's usually given for diabetic patients. Somatostatin and analogs, you do not have to worry about pharmacological intervention. That is not asked. Antiemetics and antidiarrheals. Antiemetics means medications which can prevent nausea and vomiting. Okay, antidiarrheals, you can, if the patient is suffering from diarrhea, well, it can happen because it is indigestion. Dumping syndrome basically is a type of indigestion, and the patient may suffer from diarrhea later. And invasive interventions, gastric bypass reversal. You may have to reverse the gastric bypass because gastric bypass surgery patients are at the higher risk of dumping syndrome. So, to correct the dumping syndrome, you may have to reverse the bypass surgery. Gastric pouch restriction, pancreatic resection, like putting a part of transplantation of pancreas into the patient. Okay, so these are the management through which dumping syndrome can be overcome. Next is constipation. Another name for constipation, there are different forms of constipation: atonic constipation, spastic constipation. Okay, atonic constipation means you can see the shape in which the large intestine should be, a normal large intestine, and this is how an atonic large intestine looks like. Atonic, absence of tone, muscle tone in the large intestine. Okay, that's the name meaning. Absence, atonic means absence of tone in the large intestine. So another name for this is lazy bowel syndrome. Here the large intestine loses its intestinal muscle tone. Okay, so causes: not having enough water, lack of fiber. Lack of roughage means lack of fiber in diet, lack of potassium in diet, vitamin B deficiency, irregular eating habit, purgation. It means that when you it's an eating disorder in which you use a lot of laxative. Okay, people who overuse laxatives as a part of bulimia nervosa eating disorder or anorexia nervosa as well. Okay, in certain eating disorders, you purge yourself after eating. Try to you will try to poke the back of your throat so that you can induce vomiting. Otherwise, you will eat a lot of laxatives after food so that you can push the food out of the system through too much of defecation. Okay, so overuse of laxative can also lead to atonic constipation. You can lose the muscle tone of your large intestine over the period of time. Okay. Then we have spastic um, constipation, in which there is a narrowing, which you can see here. Normal intestine, how it looks, and narrowing. Some parts of the intestine undergoes stenosis. Stenosis means narrowing. So because of this narrowing, the fecal matter is not able to pass forward. Okay, it's not the peristalsis movement will also be affected in such situation. So the fecal matter is not able to move forward. That is spastic constipation. Okay, so it slow transit constipation. Pelvic reasons for spastic constipation are first of all, slow peristalsis. Okay, pelvic floor dysynergia, like there is no synergy in which the muscle tone works. There is no synergy in which the peristalsis movement is working. In peristalsis, one part, if it is contracting, the very next part has to be relaxed. Okay, when this synergy is not there, okay, many parts are contracting together, all the other parts are in relaxed form, that is a dysynergy. Okay, so that is pelvic floor dysynergia. Irritable bowel syndrome, those who suffer from IBS, okay, that with constipation, they usually have this spastic constipation. And secondary reasons are if you have any anatomical obstruction. Some tumor, colon cancer or colon tumor, have been formed in the intestine that could lead to narrowing of the intestine. That could lead to obstruction. Certain medications, metabolic disorders, neurological or myopathic disorders, because the way how intestine is contracting and relaxing depends upon your neurons as well. It's involuntary. You do not have a control over it. Some neurological disorders may trigger dysenergy in these neurons. Okay. Psychiatric situations like somatization, anxiety, depression, okay, that could also lead to spastic constipation. Idiopathic means in certain cases, the cause of this spastic constipation is unknown. You do not know why this patient is suffering from spastic constipation. Okay, that is idiopathic means reason unknown. So management, try to have whole grains. Fiber components in whole grains is higher, so try to have more whole grains in diet. Fruits and vegetables, like oranges, apples, carrots, okay, have the peels of the vegetable fruits and vegetables as well, along with the pulp. Okay. In oranges it is not possible, but in oranges the white fiber which is which you can see, try to eat that, try not to remove it, try to eat that as well. Apples, have the unpeeled apple, not the peeled one. Okay, so adding these in diet can relieve your constipation. Coarse bran, this is an image of a coarse bran. It's also good for patients who eat who can mix this bran in their wheat flour or any other flour that they're using in the diet. Any porridges, if you're making, add this bran into that porridge. Okay, it's a really good source of fiber. If you're making bread at home, if you're making the atta or flour of any grain, okay, add this bran into that. Okay, you are naturally increasing the fiber component of the food. Dry maize, Bengal gram, onions, quinoa, beans, guava. Okay, these all are really good sources of fiber. Leaves, drumstick leaves, tamarind leaves, curry leaves. Okay, they can also help in the management of constipation. Hot water, or plain or with lemon, or slightly lemonic water on empty stomach, just to aid your peristalsis movement. Okay. Laxatives only if it is prescribed, because in some cases of constipation has happened because you have overused the laxatives. To prevent that kind of situation, laxatives should be used in constipation only and only if it is prescribed by the doctor. Next is diverticulitis or diverticular diseases. Okay. Uh, Diverticulosis is there, which can turn into diverticulitis. Okay. So, what is diverticulosis? When you have this outpouching that happens. Okay. You can see here, there is an intestine in which the mucosal lining of the intestine is leading into an outpouch. Outpouching means it is protruding outside. Okay, so this is diverticulosis. It is not that harmful, but when would it become the diverticulitis? When the fecal matter that passes through the colon gets stuck in this outpouching, it will stay there and cause inflammation. Okay, that's how you get diverticulitis. Okay, from diverticulosis it turns into diverticulitis. Itis means inflammation, infected and inflamed. Okay, so this is the diverticular disease. Two types of diverticular diseases there: diverticulosis and diverticulitis. Okay, diverticulosis is the simple outpouching. It is harmless, but it has the risk of, it has the potential of turning into an infected and inflamed diverticula. Okay. So risk factors of diverticular disease, who are at risk: patients who are younger than 50 years of age is more a virulent disease, and it is more predominant in men. Okay, incidence increases steeply with age, beginning at the age of 40 years as you go become older, and it is associated with a history of low fiber diet. Those people who in their midlife, mid adulthood, and early adulthood didn't indulge much in fiber rich food, they are at higher risk of developing diverticular diseases. So incidence is more seen in males and as compared to females, and it is most commonly seen in industrialized nations. It is less common in Asian countries, okay, where it tends to be right-sided. Here, right-sided, it could also mean that you you are eating with right hand or some other way. I'm not sure why they have mentioned it right-sided. Okay, but in industrialized nations like any European countries, okay, also Japan is an industrialized nation, so in that country as well, diverticular diseases risk is high. America as well. Okay, developed countries has the most common uh, risk of developing diverticular diseases. Medication use, chronic use of non-steroid anti-inflammatory diseases, NSAID, it can double the risk of diverticulosis, and quadruples the means 4 times the risk of perforation. This diverticulosis becomes inflamed, infected, and it will the mucosal lining can completely get disintegrated. So the outpouching which you see, it can burst open. Okay, the outpouch which you see, okay, it can burst open, and the fecal matter can passing through the intestine can get inside the peritoneal cavity. Okay, so that is the risk. Calcium channel blockers, which are given as um, cardiac cardiac disorder management, opioids, corticosteroids. Okay, these can increase the risk of perforation as well. Perforation means the outpouches can burst open, and the fecal matter can be released will get released inside the peritoneal cavity. Obesity, the risk increases with obesity. Physical activity, again, if you are not physically active, the risk is higher. Smoking, you have contradictory findings. There is no association of diverticular diseases with smoking. Okay. So it can be treated. The management of diverticulosis, it can be treated. So within 3 weeks, you can treat the diverticulitis to diverticulosis. Okay. You slowly increase the fiber in your diet along with other, like in diverticulitis, antimicrobials has to be given. And along with that, sometimes some surgical management may have to be done. If perforation has taken place, then surgical management has to be done. Okay. Calcium channel blockers are channel blockers are used for cardiac management. Okay. Usually, those who had an incidence of heart attack, or those who suffer from a lot of high blood pressure, for them calcium channel blockers are given. Okay. So after you have treated the diverticulitis, you will still have certain outpouches, and slowly when you increase the fiber intake, it goes into a maintenance phase where specific meal plans for diverticulosis patients are maintained, which naturally means high fiber meal is maintained for the patients. Okay, that is the dietary management we can do for diverticular diseases. High fiber meal plan has to be done. But when it is in the diverticulitis state, You have to use medication. Sometimes surgical interventions will be done to take the patient out of diverticulitis situation. Okay, but the out pouches may still be there, which can be ligated, or it can be left as it is. But with increase in fiber in the diet, you can go into the maintenance phase. If any slide has to be repeated, please keep this request at the last of the class, because it will interrupt the flow for other students. Dietary management of chronic diarrhea. Acute diarrhea, it can be managed using proper hydration techniques at home, giving ORS. Okay. If any infection is there, correcting the infection as well. That is the acute management of diarrhea. So dietary management of chronic diarrhea on page number 370 in new textbook on page number 377. Okay, not page number 373 in new textbook, page number 377. Table number 17.3, not 17.4, 17.3. Okay. So in severe dehydration, these are the clinical symptoms of dehydration. Diarrhea is associated with dehydration. With diarrhea, you are losing a lot of water and electrolytes from the body. Okay. So when you come across any person or any patient who is suffering from diarrhea, you have to look out for what signs and symptoms of dehydration they are facing right now. Okay. So what is the symptom of severe dehydration? The patient may be unconscious, or the patient may feel lethargic, very tired. The patient may have sunken eyes. Okay. That is eyes that seems like it has gone back into the socket. Okay. And there is a dark, like a very dark discoloration around the surrounding the eyes. Okay. Unable to drink properly, or the patient drinks very poorly. When you pinch the skin of the patient, it goes back very slowly. It takes more than 2 seconds to go back. Okay. So that is, these are the signs of severe dehydration. Moderate dehydration, restlessness, irritability, sunken eyes is there. Drinks eagerly, the patient is thirsty, and when you pinch the skin, it goes back, slowly, but it will not take more than 2 seconds. Okay. So no dehydration, the patient looks healthy, there is no sunken eyes, nothing. The skin, the skin of the patient feels hydrated as well as it is plump. Okay. So when you come across any cases of diarrhea, these are the dehydration signs and symptoms you have to look. Severe dehydration can lead to death as well. Okay. So in chronic diarrhea, there are 3 different types of diet which we have to maintain. Okay. In level 1 diet, low milk is given, 50 ml per kg per day. Curd, rice, suji, gruel with milk can be given. Okay, low milk. In diet B, that is level 2, milk-free diet has to be given, but cereal pulse mix can be given, like khichdis can be given. Amylase-rich food can be given. Diet C is level 3 diet, lactose, sucrose, and starch-free diet has to be given. Soya-based diet can be given, chicken broth, eggs, and mutton broth. Okay, these for non-vegetarians, this can be given. What kind of patient will receive what level of diet is decided by the doctors. But you should just know these are the different levels of diet. Okay. At what stage of the chronic diarrhea management, okay, at what stage of chronic diarrhea management, which level of diet has to be given, when it has to be stopped, when can they go to level 2 or level 1. Okay, it is decided by the treating doctor. Okay. Then other management, fluid management, or like what all treatment is given, they have just mentioned briefly in the textbook, but majority of this is done under a medical professional's care. Okay, specifically when it comes to chronic diarrhea, it is not these treatment methodologies are not done at home. It is done in a medical institute. Okay. Amylase is an enzyme. Okay, usually the patients who suffer from diarrhea, they are having uh, they are having trouble digestion because of the absence of this amylase enzyme. Okay. For example, even in your saliva, you have a salivary amylase. Okay, it's an enzyme which is uh, predominantly found in your the type of amylase is different. Amylases are found in your body. Some examples are like bananas, oats, whole grains, sweet potatoes. These are good. Mangoes. Okay, these are the foods that are really good in amylase. Okay, so sometimes what happens is that people who suffer from chronic diarrhea, they are not, that the body is not able to produce enough amount of amylase based enzymes. So you give them amylase rich food. Okay, we can Google it, amylase rich fruits and vegetables or food. You will get the list of it. Okay. In diarrhea, there are again three types: acute, dysentery, and chronic. Acute means it is watery diarrhea. Vomiting can also be there. Fever could be there if an infection is there along with diarrhea. Fever could also be there. Dysentery is you have diarrhea, but along with that, blood is also uh, visibly defecated during diarrhea. Okay, that is dysentery. Chronic diarrhea, recurrent long lasting diarrhea is what we call as chronic diarrhea. It is usually non-infectious. Acute diarrhea can be infectious. Food poisoning can lead to acute diarrhea. Stomach infections can lead to acute diarrhea. Chronic diarrhea is usually non-infectious. It is not caused by bacteria, virus, or any other microbes. ORS therapy can be given. You can make ORS at home as well. Okay. If you do not have ORS sachet available, you can make it at home. Just boil 1 liter of water, cool it down, and once the water has cooled down, add you have to add an handful of sugar. Okay. Handful of sugar, whatever sugar comes in your hand. Okay, one handful of sugar should be added, and 1 pinch of salt has to be added. Okay, 1 pinch means the amount of salt that you can hold between your thumb and index finger. That is 1 pinch. Okay, mix it, and throughout the day, the patient has to be given this 1 liter of water. Okay, that's how you can prepare ORS at home. But if you want to prepare 1 glass, same 1 glass of boiled water, let it cool down, add 1 teaspoon of sugar and 1 pinch of salt, and let the patient empty this glass in one go. This is the ORS that you can prepare at home. Coconut water, buttermilk, rice starch water with salt, lemon sugar salt beverage, light tea, not high tea, not strong tea. Light tea can be given with lemon, honey. Okay. Calorie intake should be low. Avoid try to giving them fat. Fat has to be reduced. in their diet. Then we have steatorrhea. Steatorrhea means having like when you excrete a lot of fat, okay, undigested fat in the faces, it is what we call it steatorrhea. Okay, steatorrhea is usually not a disease condition. It's usually associated with some other disease conditions. Okay, it's a symptom. Steatorrhea usually is a symptom to a lot of disease conditions, stomach related intestinal disease conditions. Okay, for example, when you defecate, around 2 to 6 gram of fat is released into the feces. Okay, and but when you are suffering from steatorrhea, okay, about 60 gram, okay, about 60 gram of fat can be excreted out of the body. Okay, so that is the abnormal quantity of fat getting excreted in feces. Okay, so what are the causes of steatorrhea? Chronic pancreatitis, like inflammation of pancreas from a very, very long time. It happens in alcoholics. Okay, celiac disease, those who suffer from celiac disease. I'll show the explanation of celiac disease later. Post gastrectomy, after gastric bypass surgery, or a part of of your stomach has been removed. Okay, that is gastric surgery. After that, steatorrhea may happen. Cholestasis, that is a gallbladder disorder. Okay, when the gallbladder is not able to function properly, there is a stenosis in the gallbladder which does not secrete bile. Okay, bile juice is stored in the gallbladder. In cholestasis, the gallbladder is not able to secrete the bile juice into the stomach, into the duodenum, and the fat will not get digested. Big globules of fat has to be digested into small globules, and that won't happen, so it would lead to steatorrhea. Giardiasis is a disease condition in which it's a hookworm kind of an infestation. Okay, worm infestation. It's a parasitic condition. Okay, in that also patient may suffer from steatorrhea. Then Crohn's disease. Crohn's disease also I will explain later. We have a slide coming on celiac disease and Crohn's disease. So these are the disease conditions in which steatorrhea can happen. As I mentioned earlier, steatorrhea is usually a symptom to various disease conditions. It's not, it will not happen on its own. Okay. Then we have lactose intolerance. About 60 to 70% of the global population are lactose intolerant. After you have passed your childhood age, usually majority of the people turn to be lactose intolerant. Okay, in infancy, the lactase enzyme is highly required during infancy when the child is being breastfed. But as soon as a child grows up, grows into a school children, some children as young as in the school age itself become lactose intolerant. Some become lactose intolerant in their teenage. Others become lactose intolerant in their late adulthood. Okay, but usually, generally speaking, a majority of the population is lactose intolerant, but they are unaware of it. Okay, so there are three different types of lactose intolerance. Primary hypolactasia. Hypolactasia means reduced secretion of lactase enzyme. Lactase enzyme. Okay, so it occurs when levels of lactase produced by an infant wane as they get older. As I mentioned, during infancy is when the lactase enzyme is produced at a higher level. Okay, after infancy, after the first birthday of the child, slowly the lactase enzyme production reduces. Okay, and that's a primary hypolactasia. So by the age of 6 or 7, the child may become lactose intolerant. Then secondary hypolactasia, again it's a temporary phenomenon in which occurs following the damage to small bowel, that is your your duodenal side. Okay, your small intestine. and usually it is accompanied with gastroenteritis. As soon as you have something that is milk based or lactose based, immediately you will see gas forming, bloating, okay, flatulence, okay. So this can be temporary. As soon as you have a lactase tablet, or within half an hour or within 1 hour, these symptoms may subside. Then primary congenital atelectasia. This is a genetic disorder. It's an inborn metabolic disorder in which the child is born with absence in the child is born with absence of lactase enzyme. Okay. Phenylketonuria is also a type of this. Galactasemia is also another type of this lactose intolerance. Okay. So these are the three different types of lactose intolerance. So it is the inability to digest lactose, a component in milk and other dairy products, due to the lack of enzyme called lactase in the small intestine. Symptoms: as soon as you consume milk-based products or lactose-based products, you will suffer from diarrhea, nausea, abdominal cramps, stomach aches, rumbling of the stomach. The stomach will make that sound, okay. Bloating, gas, okay. What you have to add into the diet of a lactose intolerant person: add more almonds, Brazil nuts, dried beans, almond milk, tofu, soy based products, more green leafy vegetables, okay. Calcium fortified juices and soy milk or any plant based milk, okay. Used the packaged one. Do not make the plant based milk at home until and unless if you are having the supplements, it's fine. But if you're not having the supplements, go for the tetra packages, okay, which comes fortified with not just calcium, also vitamin B12 and D and other B vitamins are present in the tetra packages. So please check what kind of uh, micro minerals and vitamins your plant-based milk packet is getting fortified with, and accordingly whatever fits your category, buy that. Fatty fish, that means essential fatty acids in general, egg yolks, beef liver, if you are a non-vegetarian. Okay, so these are the things that you have to add into the diet of a lactose intolerant person to add more protein and good fat. Okay, add more protein, calcium, and good fat into their diet. This is what you have to do. You have to avoid milk and milk products, products with dairy found in it. Just read the packaging, read the ingredient list, okay. Bread, baked goods, breakfast cereals, instant soup, these things you have to avoid. They may have some form of lactose in that. Milk based liquids, powders, powdered coffee creamers, okay, processed meats, try to avoid this. Celiac disease. So celiac disease, you can see here anatomically, the normal villi of a healthy intestine, small intestine, is longer. It's elongated. This is what leads to the absorption of nutrients. Okay. In celiac disease, there is no elongation found in the intestinal villi. Either it is damaged or flattened by birth. Okay. Anatomically, it is like this by birth. Okay, that is the reason of celiac disease. Okay. So they cannot tolerate gluten. People who have celiac disease and people who have gluten allergy, only they have to avoid gluten in their diet. Nobody else, okay. Hardly 1 or 2% of the entire global population could suffer from celiac disease. That means this 1 or 2% of the global population, only they need to be in a gluten free diet, okay. Nobody else, the general population, is completely fine with gluten, okay. It does not cause any harm. Gluten is a protein. It makes like when you add water into a flour, like wheat flour, okay, it gets sticky and gooey. It's because of the gluten protein, okay. So this is celiac disease. This is the reason why celiac disease happens when the intestinal villi is flattened. It leads to celiac disease by birth or because of any later damages. So celiac disease is usually inherited. It's an immune mediated intolerance disease, and it has this intolerance towards gluten, dietary gluten. So gluten is an amino acid. It's a protein, okay, which is found in wheat, barley, rye, okay, and in very less amount it's found in oats. Oats does not have too much of gluten in it. It has very few amount of gluten. So as soon as a celiac disease person has this gluten based food, it will trigger an immune reaction, and because of which a lot of other intestinal absorption syndromes, steatorrhea, or cramps, constipation, other digestive issues will also follow. It's autoimmune disease, and it usually remains undiagnosed because you eat regular food and you feel uh, bloated, and you do not know why you feel this bloating. Nobody realizes that it's because of the gluten, which is abundantly found in majority of the staple disease, and that's causing the bloating and the reaction, autoimmune reaction. And if it is left untreated, if the celiac disease is left untreated, means if you try to still continue having gluten, suffering from celiac disease, it could lead to other conditions like osteoporosis, anemia, thyroid disease, and certain cancers, because your intestine is not able to absorb quality nutrients. Okay. So these are the grains that contain gluten, which you have to avoid if you suffer from celiac disease: wheat, rye, barley, uh, triticale, okay, not commonly found in India. Gluten-free grains, you have a majority of it: rice, quinoa, amaranth, sesame, chia seeds, sorghum, that is jowar, oats have few amount of gluten. It's not completely gluten-free. Oats have gluten to a very less extent. Okay, all your millets like ragi, buckwheat, flax seeds, corn, soybean, kidney bean, lentils, pea, chickpea, okay, they all are gluten-free grains. Next situation is a tropical sprue. It's a malabsorption disease commonly found in the tropical regions. Even in India, India is a tropical country. It is marked by abnormal flattening of the villi, just like how you saw in celiac disease. Even in tropical sprue, flattening of villi is seen. Inflammation of the small lining is also seen. So symptoms, those who suffer from tropical sprue, they may suffer from diarrhea, anorexia, abdominal distension, okay, nutritional deficiency, lose a lot of weight. Some people may also have swelling in their lower extremities, legs and all. In treatment, you have to rehydrate them, okay, with fluids, electrolytes, nutrients. All the deficiencies has to be corrected. Antibiotics may be required if any infection is also present along with the tropical sprue. Folate therapy, that is folic acid, vitamin B complex therapy, will be started along with other nutrients, not just folate. Vitamin B12 may also be required here, 1000 microgram on a monthly basis. So tropical sprue is commonly seen in tropical countries like India as well. Okay, it happens in the same way how celiac disease happens, and flattening of the intestinal villi, and that leads to all these signs and symptoms. Next, we have Crohn's disease. So in Crohn's disease, it's inflammation, but it's usually patchy inflammation. Okay, when a part of the intestine is getting inflamed, it's usually the ascending colon, transverse colon, or descending colon, or the sigmoid colon. Okay, any one entire part of the intestine gets inflamed. That's what we call IBS, irritable bowel syndrome. Okay, one entire section of the intestine is inflamed. But In Crohn's disease, inflammation is present, but it is present in patches all over the intestine as well as the small intestine. Okay, that's Crohn's disease. Small intestine as well as the large intestine, small patches of inflammation here and there. Okay. So, dietary management, those who come under the BMI of 20 to 29, 25 to 30 kilocalories per kg energy has to be maintained for people who suffer from Crohn's disease. High protein diet should be started. Low fiber diet, specifically in Crohn's disease, if it is associated with certain fistures and fistulas and strictures. Fistulas means, you can see here, is it visible to all? This part where I'm pointing the arrow, it's a small intestine which is getting connected into the large intestine. But you can see an abnormal pathway which is formed between the sigmoid colon and the small intestine, which should not happen. Normally, it should not happen. But you can see an abnormal pathway getting created here. Is it visible to all? So this is a fistula. This is a fistula. Okay. Here you can see strictures. How the transverse colon comes, okay, it has a proper wide part, and then it narrows down. It narrows down too much. This is a stricture. Okay. Is it visible? Is the stricture visible? So that's the fissure and fistula and a stricture. So if the patient is suffering from these two situations, then the patient has to maintain low fiber diet, because what happens with high fiber diet is that peristalsis movement will be high. The way how which the feces, the fecal matter is going to pass through the entire intestine will be at a higher speed, and sometimes it can get strictures can perforate, or through fistula it can go back into the intestine, cause some infection, inflammation. So you have to avoid high fiber diet in this situation. If fistulas and strictures are not present, normal level of fiber diet can be given. Tube feeding and enteral feeding in complicated cases. Okay, if the case becomes very complicated, via mouth, food through via mouth cannot manage the situation. In that situation, tube feeding or enteral feeding can be started. Enteral feeding means through your IV fluids. Limit fats. Try to limit the use of fats. No need to completely restrict it. Limit fats. Increase the intake of omega-3 fatty acids through supplementation also, it's fine. Check for intolerances. Food intolerances test can be done. Okay, so any food that is triggering the current situation, that could be completely restricted. Probiotics are beneficial here. Probiotic rich foods like yogurts, okay, kefir yogurt, Yakult, okay, these are probiotic rich food. So curd as well, pickles. Low fiber diet is given because high fiber diet can trigger the entry of feces into the fistula. and it can lead to perforation. Next, we have ulcerative colitis. Ulcerative colitis. Okay. Ulcer formation in your colon, large intestine, and that leads to inflammation. Okay. You can see here how the normal intestine looks like and how the inflamed intestine because of ulceration looks like. So there are different types of ulcerative colitis. Proctitis, which means just the rectum, okay, rectum area and the anal area, rectum has this inflammation. Proctosigmoiditis, okay, the rectum along with the sigmoid colon is inflamed. Distal colitis, rectum, sigmoid colon, and the descending colon is inflamed. Extensive colitis is along with the transverse colon, descending colon, sigmoid colon, and rectum is inflamed and ulcers are present. Pancolitis means the entire large intestine is inflamed. Okay, so these are the different types of ulcerative colitis. And again here, the objective of the treatment is short chain fatty acids are used here. Short chain fatty acids are types of lipids which do not require too much of digestion in acute stages. Fluid and electrolyte balance has to be corrected. Any dehydration, if it is there, it has to be corrected. Any micro deficiencies present should be corrected. Fiber should be restricted. Diarrhea can be corrected. Probiotic medications or probiotic food can be given to give some relief. And if the energy requirement is based on the BMI, usually it is 30 to 35 calories per kg body weight has to be maintained. Low fiber diet is needed to minimize the fecal volume. Okay, you do not want too much of feces, feces passing through this inflamed large intestine. Okay, you want small amount of feces passing through the inflamed large intestine. So low fiber diet has to be maintained. Taking a balanced diet, including fish oil, because essential omega-3 fatty acids are required. Soluble fiber is chosen here. Antioxidant-rich diet. If the patient is already on some steroid medication, reduce the doses. Total parenteral nutrition is useful here because you are restricting the tube feeding, you are restricting any gastric feeding, you are completely restricting everything through the intestine. So in this situation, TPN can work, total parenteral nutrition. The whatever nutrition the patient is getting, he or she is getting through the parenteral route, enteral route. Okay. Vitamin and mineral supplementation can also be required. It can be given if any deficiencies are there. MCT is a kind of oil that can also be given. Next is IBS, irritable bowel syndrome. So IBS, you can see here, one entire part of an intestine will be inflamed, and this inflammation can lead to abnormal contraction. Okay, whatever part of the intestine is inflamed, abnormal contraction can take place. It will not follow your regular peristalsis movement. Okay, abnormally, here and there contractions can take place, which will lead to constipation, or sometimes it could lead to diarrhea as well. Okay, in IBS, both can happen, either diarrhea, frequent diarrhea, or either frequent constipation. Both can happen. Okay, so the muscular layer of your intestine is malfunctioning here. Okay, and that's why you are getting abnormal contractions. Foods that may trigger IBS, you have apples, beans, broccoli, okay, cabbage, caffeine, cauliflowers, gums, beverages, for food sweetened with fructose or sorbitol. Okay, usually packaged food. Okay, chocolates, dairy products, fatty foods, margarine, that is that rich jam. Okay, to the jam, that is fruit jam, that are too sweet. Okay, nuts, orange, grapefruit juices, wheat products, because sometimes it could gluten can also trigger IBS. Okay, so diarrhea and constipation both can happen here, along with abdominal pain, bloating. Okay, too much of flatulence, and when the patient defecates, they feel there is an incomplete defecation. Pain in the rectal region, mucus in the stool may also occur. So these are the signs and symptoms of IBS. Treatment of IBS, you may have to go low on FODMAPs. Okay, FODMAPs are fermentable di and monosaccharides. About FODMAPs, we will discuss in detail in another chapter. Okay, I'll give you the examples of the food that come under FODMAP. That food has to be completely avoided in IBS situation. Even artificial sweeteners has to be avoided. And in treatment, melatonin based tablets or melatonin based supplements can be helpful in IBS. And even in anxiety, depression, sleeping disorders, melatonin supplements are given. Melatonin can induce um, a stress-free Zen mood in the patient. Okay, people who suffer from a lot of stress, those who are not getting sleep, they have melatonin supplements to induce sleep. So that can be helpful to reduce the symptoms of IBS. But there is no one size fit all treatment that happens for IBS. It's a very subjective situation. Every IBS condition is different from another. Okay, some may have only inflammation, some may have abnormal contraction, some patients may suffer from diarrhea, others may suffer from constipation. So we cannot say what exactly is causing IBS in them. Okay, it is a very individualized care plan and medical management that the gastroenterologist will plan for the patient. Okay. Then we have intestinal gas. So intestinal gas, signs and symptoms of it is bloating, uh, belching. Belching means dakar. In Hindi, we call it as dakar. Burping. Okay. Uh, Dill leaves can lead to intestinal gas for some people. Too much of flatulence. Okay. Heaviness in the abdomen, even if you have had very small amount of portion size of food, but the abdomen feels really heavy. Too much of milk. If you're lactose intolerant, milk can cause intestinal gas, abdominal pain, diarrhea, and constipation. Certain medications can lead to intestinal gas. Okay, heartburn, acidity, and there are foods that causes gases. For example, cabbage, cruciferous food. Okay, sulfur-containing food. Uh, Foods that have a strong pungent odor and taste, like onions, garlic. Okay, they can also lead to gas formations. So to maintain to make sure that intestinal gas is reduced, you can follow the diet in which this food can be avoided. Okay, common foods that causes gas and bloating: cabbage, cauliflower, beans, oats, apple, milk, fluffy wheat, that is refined flours, broccoli, onion, corn, potatoes, pears, soft cheeses, peaches. Okay, these are the foods that are usually associated with gas. Ginger tea and ajwain, that is carom seeds. These are home remedies that can be helpful to prevent the symptoms of gas or to reduce gas formation. Having ginger based juice or having a ginger lemon water before you have food can prevent gas formation, or after food as well. Okay. If you are suffering from gas throughout the entire day, make sure you switch your water with ajwain water. Just boil ajwain in hot water and keep drinking that entire hot water throughout the day. Don't have just plain water. Keep drinking ajwain water. It will go bad within a day. Within 24 hours, it will go bad. So keep drinking ajwain water throughout the day. You will see relief in the symptoms. Okay. Other medications are available when you visit the doctor. They will give you gas relieving medications. Okay, but otherwise, these are the home remedies which usually work. Okay. Arrowroot is also helpful. For some people, arrowroot is helpful to prevent gas if you're suffering from gastric issues, arrowroot porridge or using arrowroot powder in the diet can reduce the symptoms.